o sanitize ng kamay at pagpiling magpabakuna. Pag pinagsama-sama po natin lahat yan ay malaki ang contribution para sa pag-improve ng ating COVID-19 situation at mas maging ligtas ang ating mga komunidad. So can we go on to the next slide, please? So we will be providing you with the latest biosurveillance updates. We have sequenced a total of 19,389 samples as of November 6, of which 89.18% have assigned lineages. Latest run is comprised of 748 samples collected in March, April, May, June, September, and October. Of this, 2.94% or 22 were positive from the Alpha variant, 2.01% or 15 of samples were positive for the Beta variant, 87.03% or 651 were positive for the Delta variant, 1 was positive for the B.1.617.1 variant or the Kappa variant, a variant under monitoring, and 1 was positive for the B.1.1.318 variant, another variant under monitoring. Also, of the total 6 sequenced samples, incoming international travelers comprise of 1,171 or 6.04%. We are doing retrospective sampling to trace the beginnings of the Delta variant introduction to the country as well as its earliest cases. Of the 17,292 samples sequenced assigned with a lineage as of November 6, 34.59% of samples were positive for the Delta variant, 20.69% of samples were positive for the Beta variant, 18.09% were positive for the Alpha variant, and 0.02% were positive for the Gamma variant. Among all the sequenced samples in the Philippines, 73.4% of the 17,292 samples with assigned lineages were positive for the Alpha, the Beta, or the Delta variant. All 17 regions either have an Alpha, a Beta, or a Delta variant case. In the National Capital Region, all cities and its lone municipality were found to have a variant of concern. Also, 804 or 68.7% of the returning overseas Filipinos were positive for a variant of concern. A gradual increase in the proportion of the variants of concern with respect to the total sample sequence has been seen at the national level since the detection of the first local Alpha and Beta variant cases. Variant of concern cases only accounted for 24.8% of the samples collected in the month of February of this year. In March, however, the variant of concern cases comprised of 82.2% of the total samples. The increase has been consistent for the succeeding months. At present, for samples collected in October, variant of concern cases now comprise about 99%. In addition, similar to other variants of concern, since the detection of the first local Delta variant case collected in April, an increase in the proportion of Delta variant cases were seen for the succeeding months. The increased proportion of these variants can be attributed to the increased transmissibility. However, sampling methodology also affects these proportions as samples from target areas or populations are prioritized more. Such populations or areas include samples belonging to clusters, severe or critical cases, admitted cases, samples from areas with sudden increase in COVID-19 cases among fully vaccinated individuals, and cases from returning overseas Filipinos. In addition to purposive sampling, the number of samples sequenced varied from month to month due to the limited resources available. Target populations had been prioritized in the sequencing runs done from May to June, which may have contributed to the skew of variant of concern cases for these months. The B.1.617.1 variant was formerly known as the Kappa variant. It is a variant of interest, but as of September 2021, it was declassified and is currently designated by the WHO as a variant under monitoring. The first case of the B.1.617.1 variant is a local case from Florida Blanca, Pampanga. The case is a 32-year-old male that had mild disease severity and is now tagged as recovered. During the time of collection, that was June 2 of 2021, the B.1.617.1 variant was still designated as a variant of interest. Further investigation is being done by our Regional Epidemiology and Surveillance Unit in order to gather more information on this case, and there is strict monitoring of this case and the community. On November 7, 2,605 new cases were recorded, bringing the total reported confirmed cases to 2,803,213, of which 1.2% are active cases, 97.22% are recoveries, and 1.58% are deaths. Looking more closely at our active cases, 87.13% of these are either asymptomatic, mild, or moderate, while 12.87% are severe and critical. For November 7, the top 5 regions contributing to these new cases are NCR, Regions 2, 4A, CAR, and 3. And the top 5 areas contributing to these new cases are Isabela, Negros Oriental, Zamboanga City, Quezon City, and Rizal. Our epidemic curve shows that the current average daily cases have further decreased by 46% this week. Nationally, we are at low-risk case classification with a negative 2-week growth rate at negative 48%, and a moderate risk average daily attack rate at 3.04 cases for every 100,000 individuals. The National Health System's capacity is currently at low risk. All regions shows a negative 2-week growth rate and low to moderate risk case classification. 2 regions, CAR and Region 2, remain with high risk average daily attack rates. Region 2 remain with ICU utilization at high risk at 77% capacity. The remaining regions have low to moderate bed and/or ICU utilization rates. The National Capital Region shows a negative 2-week growth rate and a moderate risk average daily attack rate and is currently at low risk case classification. The ADAR decreased to 4.35 per 100,000 population in the recent week. Its bed and ICU utilization is both at low risk. In NCR, the 7-day moving average shows a downward trend as cases in the recent 7 days have decreased compared to the previous 7 days by 403 cases or by 50%. The current 7-day moving average of 429 cases per day is the lowest since February 2021 at 443 cases per day. The NCR's total bed utilization has been on a decline since mid-September, currently at low risk at 28%. However, utilization is seen to be plateauing in the recent week. The total dedicated beds have increased in August and has remained between 9,000 to 10,000 dedicated beds. From July 1 to November 6, the total beds increased by 11%. The current total bed occupancy is lower than in July 1 by 448 beds or 13%. The National Capital Region ICU utilization had been decreasing since mid-September and is currently at low risk at 40%. From July 1 to November 6, the total ICU beds increased by 257 or 23%. The allocated ICU beds seem to be decreasing in the recent week, which are the gray bars. The current occupied ICU beds are still higher than in July by 74 or 16% of the beds. The national deaths peaked in September. Along with the decline of our cases, we see that weekly deaths are also on a downward trend since the start of October. I would like to highlight the following key messages for this week. All regions show a negative 2-week growth rate and low to moderate risk case classification. 2 regions, CAR and Region 2, remain with high risk average daily attack rates. Improvements in case trends should not result in complacency. We must continue to strengthen our local response in all areas to hammer down daily cases. Our conscious adherence to the minimum public health standards and avoidance of the 3 Cs, closed, crowded, and close contact settings, will prevent or control COVID-19 transmission. So let us encourage our family members, our neighbors, our co-workers to get vaccinated now, that the COVID-19 vaccination program includes those aged 12 and above. That is all. Over to you, Jolo.
Thank you po, Yusek, for giving us the national situationer. Now for our media questions, we go straight to the question on face shield use po. Our media partners have sent several questions regarding face shields. Yusek, ano po ang rekomendasyon ng IATF on face shield use? And Manila Mayor Isko Moreno will issue an EO on making face shields non-mandatory na po sa Manila. Ano po ang reaksyon ng DOH on this, and pwede po ba itong gawin ni Mayor Isko?
Yes, no. So on this question, Caroline and the others who have asked this question, unang-una po, meron po tayong existing IATF resolution which indicates that face shield should be used in 3C settings across the different alert level system. Meron din po tayo na joint memo circular coming from different national agencies and has been approved by IATF as well. So ngayon po ang usapan with the IATF last Thursday, our experts together with DOH of course will update the current review of evidence for this face shield use in this pandemic response. So we have committed to the IATF that by Thursday, we will be presenting to them an updated recommendation for the use of face shields. So ngayong hapon po, we already have a meeting with our TAG experts together with the Living CPG team. The Living CPG team have already re-evaluated, they already have their updated recommendations, and they will be presenting this afternoon to us so that we can discuss and we can further provide recommendations to the IATF on Thursday. So nananawagan po tayo sa ating mga local governments, antayin po natin yung IATF na makapagbigay ng kanilang agreement or decision regarding the face shield. Until we can have the IATF resolution, we urge all local governments to just hold their executive orders or their issuances so that we can all be uniform in our implementation and we are all aligned. So we leave it to the ILG po to manage this kind of issues. We're just saying right now that the DOH together with our experts are going to meet this afternoon so that we can discuss this face shield use for the pandemic response, and we will provide our recommendations on Thursday in the IATF meeting.
Thank you po, Yusek, for the clarification. The next question is from Donna Pazdugan of the Philippine Daily Inquirer. For her first question, is it a cause of concern that the proportion of hospitalized active cases, both severe and critical, is increasing and now nearly 30%? What accounts for the increase, and does this mean our hospitals are still full, though new cases have gone down?
Donna, ito pong pagtaas ng mga kaso, no, when we have confirmed, no, nung kinumpirma natin na bumababa na po talaga ang mga kaso dito sa ating bansa and even in NCR, kasama po yung rate of admission dun sa aming ginawang basihan. And we have seen that the rate of admissions and those number of people still admitted in the hospitals ay bumaba na rin po. Now, if you will look at yung severe and critical, as the numbers of active cases go down, the number or the percentage for severe and critical tumataas. Kasi po, pag bumababa na yung numero na denominator po yun, that's a function of the numbers. But anyway, meron din hong function kasi kapag ka severe and critical ang mga kaso, mas matagal po silang naglalagi sa ospital. They have longer admission days compared to the mild, the moderate, and the asymptomatic. Kasi po sila, ang minimum nila is mga 21 days or even more kapag talagang kailangan nila ng rehabilitation and further management for their illness. Kaya makikita ho natin, bago natin ma-decongest ang ating mga ICUs for the severe and critical, mas matagal kaysa sa mga ordinary isolation and ward beds. And just to give you the statistics, no, for our admissions coming from our health facility capacity report, noon pong September 12, ang total admitted cases natin was at 32,334. Ang severe and critical po dito sa 32,000 was 7,752. And then on October 24, 2021, ang total admitted cases natin went down to 17,521 and the severe and critical went down to 4,094 cases. So you would see na ito pong ating mga statistics ay talagang further going down. And as I've said, and let me just reiterate, paliwanag po natin, hindi po dahil meron pa tayong severe and critical sa loob ng ating mga ICU at mga ospital ay nangangahulugan na tumataas pa rin po ang mga kaso sa ating mga lugar. Ibig sabihin lang po kasi mas matagal silang naglalagi sa ospital kaya hindi pa ho natin nadidecongest maigi ang ating mga ICU. Although meron pa rin talaga tayong ina-admit na mga bagong severe and critical, but not as much as we have had the severe and critical cases na tumaas talaga noon pong August at September ng taong ito.
Thank you po, Yusek. The next question of Donna is, ilan po ang vaccines expiring this November and saang mga lugar ito nakadeploy o ide-deploy?
Yes, no? So Donna, itong mga expiring vaccines na sinasabi, we received donations coming from different governments, no, across the globe, at saka yung sa COVAX facility rin meron din tayong na-receive na ganito. And most of these vaccines are set to expire the end of November. Kaya nung atin pong natanggap itong mga bakunang ito, agad-agad po natin itong dineploy. Dineploy natin dun sa mga mabibilis o yung mga fast moving na mga local governments that they can vaccinate as many as possible in a given day. So dyan po natin binigay ang ating mga bakuna at sa ngayon po ay ginagamit na po itong mga bakunang ito. Pangalawa, yun sa private procurement po ng Moderna, we had a policy, yung tinatawag natin na loaning agreement, kung saan kinuha po natin yung doses ng private sector para po magamit na natin at ma-deploy at hindi mag-expire, papalitan na lang po natin yung kanilang mga bakuna kapag gagamitin na po nila. So wala po tayong nasayang na bakuna, wala po tayong masasayang na bakuna. We were able to strategize kahit po na mga expiring na po yung ibinigay sa atin by the end of November. We were able to deploy it at once to the local governments which have fast moving or mabilis po silang magbakuna in a given day.
Thank you po, Yusek. The next question is from Sheila Chrysostom of the Philippine Star. Itong weekend, tumagsa ang mga tao sa malls at iba pang public places at hindi na nasunod ang protocols on distancing. In-expect ba ng DOH na tumaas muli ang kaso dahil dito?
Sheila, the possibility is there. Kaya araw-araw talaga, Sheila, tayo ay nagpapaalala sa ating mga kababayan na bagamat napunta na tayo sa alert level 2, alam din natin sabik na sabik ang ating mga kababayan na lumabas at they can enjoy with their families outside. Hindi po natin yan pinipigilan dahil allowed naman po. Pero sana po lahat tayo will be responsible enough at maisip natin na naandito pa ho yung virus. We are not out of the woods yet. Kailangan pa rin ho natin ipatupad ang ating mga minimum public health standards. Kung tayo po ay nasa labas, sana po tayo po ay laging cautious, lagi po tayong aware of our surroundings, lagi pong suot ang ating mga mask at face shields kung matatao ang lugar, at lagi po nating siguraduhin na hindi po tayo magpupunta dun sa overly crowded na area. Pag nakita na ho nating madami ang tao, wag na muna po tayong tumuloy para maiwasan po nating magkasakit o di kaya ay makapanghawa sa iba. Nananawagan din po kami sa ating mga local governments now that we are on alert level 2. The only way that we can be able to sustain this kind of opening up of the economy and this kind of low-risk case classification is for local governments to truly enforce and monitor the compliance to minimum public health standards. Tandaan po natin yung projections na amin pong nailahad sa inyo nung Sabado na tayo ay nag-report. Ang atin pong mga assumptions sa ating mga projections na ginamit, unang-una po dyan ang mobility ng mga tao. Pangalawa po yung compliance sa minimum public health standards. Pangatlo, yung ating response ng local government, yung mapaikli ang detection to isolation. And fourth is vaccination. Nakalagay po dyan sa projections natin na kapag po ang mobility ay tumaas from this baseline na ginamit natin, ngayon po current time, Pag tumaas po yan at bumaba ang compliance to minimum public health standards, even just for 30% na mare-reduce ang pag-comply ng tao sa minimum public health standards, maari pong tumaas uli ang ating mga kaso pagdating po ng December 15. So ayaw po nating tumaas ang mga kaso natin, lalong-lalo padating na po ang Kapaskuhan at gusto po natin magsama-sama kasama ng ating pamilya. So again, nakikiusap po tayo na sana po lahat po tayo magtulong-tulong so that we can maintain this low case risk classification across the National Capital Region and even the whole country.
Thank you po, Yusek. The next question from Sheila is, please give updates on pediatric vaccination. How many were inoculated and how many adverse events were recorded?
Yes, Sheila, no? So we were already able to inoculate among the pediatric population 230,357 adolescents vaccinated as reported by the National Vaccine Operations Center. And for the adverse events, it's just about 0.10%. It's 0.10% reported adverse events following immunization among all of these 200 plus thousand adolescents. The top 3 most frequently reported are the expected temporary reactions like meron pong vaccination site pain, masakit ang ulo o kaya ay nahihilo. Meron din po na mga kabataan na binakunahan na nagkaroon ng anxiety-related symptoms na pagkatapos pong mahimasmasan ay nawala na rin po. Lahat po ng ating mga kaso ng adverse reactions were all managed, they were all addressed, at lahat po ng ating mga kabataan na nagkaroon ng ganitong reaksyon ay napauwi din naman po after proper management.
Thank you po, Yusek. The next question is from Aiko Miguel of UNTV. May update na po ba sa Delta Plus subvariant with 5 more mutations? Is it more transmissible po than the Delta variant? Ano po ang epekto nito sa COVID-19 vaccines that we have?
Yes, Aiko, until now, this AY.4.2 is still being studied further by experts across the globe. It has been classified by the WHO as a variant under monitoring. Ibig sabihin, minomonitor at pinag-aaralan. May mga lumabas na pauna no, ng mga artikulo before na sinasabi nila that this sublineage no, of Delta, itong AY.4.2, ay mas transmissible by about 10 to 15% than the original na Delta variant. Pero hindi po natin yan pwede munang gamitin dahil hindi pa ho kompleto lahat ng ebidensya. So pinag-aaralan natin lahat yan. Ang sinasabi po, ang itong Delta variant na to dahil naging masyadong mataas ang transmissibility at nakaapekto ng malaking portion ng population sa buong mundo, kaya nagkaroon ng capability to mutate. Actually, yung kanyang mga sublineages na tinatawag is I think it's more than 90 already, no? Yung sinasabi nilang mga mutations or sublineages ng Delta variant. It's from AY.1 to AY.95. So it's 95. So ganun na po kadami yung sublineages ng Delta variant because of its mutations. Lahat po yan sa ngayon pinag-aaralan lahat. Lahat po na magiging epekto nito on transmission and also on our vaccines, pinag-aaralan din po yan. At aabangan po natin kapag nakapaglabas na po ng kompletong ebidensya. Up until now, based from our latest sequencing results, wala pa ho tayong nadedetect na ganitong sublineage ng Delta variant dito sa ating bansa.
Thank you po, Yusek, for the clarification. For her next question, how strict are the measures that we have to make sure that passengers from countries with Delta Plus cases are not carriers of the Delta Plus variant?
Yes, no? So Aiko, sabi natin, lagi natin sinasabi, kung ano po yung pinapatupad natin ngayon ng mga protocols, these are all effective against any type of variant. So kung tayo po ay susunod sa minimum public health standards like using your face mask and your face shield, doing physical distancing, recognizing the 3C setting, palagi ang magugas ng kamay, and of course, yung 4-door strategy natin. Yung border control, yung ating quarantine at that site, dun sa ating ports of entry, testing, and also yung community response natin, ito po lahat ay epektibo against any type of variant. So for us to be able to ensure no, na yun pong mga papasok sa ating bansa ay wala po nitong mga variants na to, kailangan maipatupad pa rin po nating maigi ang mga protocols na meron tayo sa ngayon. This will still protect us from any type of variant that may come in the country.
Thank you po, Yusek. I will now be moving on to the Zoom chat question sent by our media partners. So the first question is from Caroline Bonkin of CNN Philippines. For her question, ilang araw na lang po ang detection to isolation?
Yes, Caroline, yung latest natin as of October, nationally it's 6.8 days detection to isolation time period, and for the National Capital Region, it's 5.5 days. So kung matatandaan nyo, nag-uumpisa po tayo ng shift ng policy natin, and that was around late September, na ipababa po natin because of these granular lockdowns na sinasagawa, itong ating detection to isolation sa NCR to just about 4 days. Kaya lang ngayon, siguro po, medyo dumadami po yung lumalabas ang mga tao, nagkakaroon po ng medyo pagbaba ng ating testing, kaya po yung ating detection to isolation ay nagkaroon ng 5.5 days uli. So nakausap na po natin ang ating mga local governments. And again, we are reiterating, napaka-importante that once we detect a case, we immediately isolate them. They were able to do, local governments in Metro Manila were able to do as low as 2 days in granular lockdown areas. And hanggang sa ngayon naman po, pag sa granular lockdown areas, mababa o nasa 2 days to 3 days sila. Ito lang pong average talaga na 5.5 days because this is both for granular and non-granular areas.
Thank you po, Yusek. The next question is from Neil Joe Morales of Reuters. Pfizer successfully developed Paxlovid, an oral antiviral treatment for COVID-19, which showed an 89% reduction in hospitalization and deaths for those most at risk. May we ask what actions has the Philippines taken to secure these pills? Are we in talks to secure supply, and how much are we buying po?
Yes, Neil, no? So pagdating sa mga ganitong innovations, pag sa mga investigational drugs, nakatutok naman po tayo lagi kung ano po yung mga bagong lumalabas, ano yung makaka-benefit sa ating population in terms of our response to COVID. Sa ngayon po, wala pa hong nag-aalok sa atin nitong gamot na ito. No talks has been done yet, but we are constantly monitoring itong nangyayari ngayon tungkol dito sa gamot na ito. Ang kailangan natin maintindihan kapag may mga bago pong investigational drugs, kailangan lagi natin ng authority coming from the Food and Drug Administration. It may be an emergency use authority or it may be a compassionate special permit. But everybody goes through our Food and Drug Administration so that we can be able to ensure na yung ipapagamit natin na gamot sa ating mga kababayan ay magiging ligtas ang ating mga kababayan at alam natin magiging epektibo para sa kanila. So antayin po natin in the coming days or weeks, maybe the supplier may be able to propose to the Department of Health regarding this drug.
Thank you po, Yusek. The next question is from Lee Alvis of GMA News. While almost 90% na ang vaccination coverage target population sa NCR, sa ibang probinsya ay wala pa raw sa 50% base sa mapping ng Go Negosyo. Sa BARM ay 10% pala. Ito po ang factors ng mababang coverage sa mga probinsya at anong gagawin para makahabol sila? Kailan po ang 3 araw na National Vaccination Days?
Yes, Lay, no? So unang-una, nagkaroon tayo ng survey across the different areas of the country. Tinignan natin kung ano yung mga factors that affects vaccine confidence in different settings, no? In different areas in the country. Unang-una na yung misinformation pa rin, ano? Yung misinformation na marami kasing lumalabas sa social media, so natatakot ang ating mga kababayan na magpabakuna. So ngayon po sinasabi ko po sa ating mga kababayan, wala po kayong dapat ikatakot. Milyon-milyon na po ang nabakunahan dito po sa ating bansa. Ito pong mga ginagamit natin ng mga bakuna for COVID-19. At wala pa ho tayong nababalitaan, wala pa tayong naire-report na nagkaroon talaga ng masamang insidente as a result of this vaccine. The vaccines are safe. Ito po ay binigyan na ng ganitong clearance ng ating Food and Drug Administration. Ito po ay ligtas, ito po ay epektibo na ipakita na po ng mga bakunang ito kung gaano nila naprotektahan ang ating mga kababayan, lalong-lalo na nung tumaas sa mga kaso dito sa ating bansa. So paniwalaan po natin ang bakuna, paniwalaan po natin ang ating proseso. hindi po magbibigay ang gobyerno ng isang bagay na makakasakit o magkakaroon po ng danger sa inyong mga buhay. So tayo po ay maniwala sa bakuna kasi ito po yung makakapagprotekta sa atin against severe diseases and against deaths from COVID-19. Ang pangalawa na naging factor would be vaccine preference pa rin. So marami sa ating mga kababayan across the different regions of the country, may vaccine preference sila. So halimbawa, dumating ang vaccine type A sa kanilang lugar, mas gugustuhin nila na antayin kung dadating pa yung kanilang vaccine na gusto. Maybe vaccine type B or vaccine type C. Pero yung kanilang vaccine preference ay naandun pa rin. Ang isa sa mga bagay na atin pong gustong pabulaanan or gusto natin ipaliwanag sa ating mga kababayan. Lahat po ng bakuna na meron tayo ngayon dito sa ating bansa, pantay-pantay po sila. Sila po lahat ay nakakaprotekta sa atin laban sa severe o yung malalang form ng sakit ng COVID-19, nakakaprotekta rin po siya laban sa pagkakamatay sa sakit na ito. So kahit ano pong bakuna ang iturok sa atin, ito po ay magbibigay pa rin ng protection sa atin. So sana po, huwag na ho tayong piliin kung ano po yung may bakuna dyan, yan po lahat ay makakapagbigay ng protection sa inyo at sa inyong pamilya. So yun pong mga ginagawa natin ngayon, Lay. We are really intensifying our vaccine efforts kung saan nag-mobilize na po tayo ng mga tao para makapagbigay ng further information sa baba. Meron na rin po tayong mga ginagawang community-based, kung saan magbabakuna tayo sa komunidad. And ito nga pong sinasabing 3 days mass vaccination. Ginagawa pa lang yung guidelines, Lay. Wala pang mga initial details for this. We are also coordinating with our regional units, both not just for DOH but for the other agencies kasi whole of government natin gagawin. Nakikipag-coordinate na rin tayo sa private sector para matulungan tayo. We are now coordinating with establishments so that we can expand vaccination sites. Kanina lang po, galing po ako sa Quezon City. Nag-launch po tayo nung donated ng USAID ng mga jeepneys. Yung mga jeepneys po gagamitin na sa komunidad para magkaroon po tayo ng mga bakunahan dun sa mga lugar na hirap pong pumunta sa vaccination sites, maaari na pong mabakunahan through this. So ito po ay isang magandang effort ng ating local government kila Mayor Joy Belmonte and of course, yun pong tulong ng USAID sa ating gobyerno.
Thank you po, Yusek. The next question is from Sheila Crisostomo of the Philippine Star. 99% of lineages detected were Delta variant. How can this be reconciled with the decline in COVID-19 cases since Delta is known to be highly transmissible po?
Yes, Sheila. So, una, tandaan natin, we are just doing sampling. So, hindi po natin nasa-sample ang buong populasyon. What we only have is a portion of the population which is representative enough to say that here in the country, ang mas malaki po na nasa sample na natin ngayon are mostly Delta variant. This is for trending. This is not to say that I have detected or I have tested each and every person infected with the COVID-19 here in the country. Pangalawa, Sheila, yun pong ating timelines ng pagtetest, hindi po lahat yan ay exactly happening right now, or just last week or 2 weeks ago. Sabi nga natin, we are doing retrospective sampling. Ibig sabihin, kinukuha natin as early as March and April para makita natin kung saan talaga nagmula ang Delta variants dito sa ating bansa. So ibig sabihin, yung mga tao na na-detect na natin from the previous months, naka-recover na sila. So kahit nasabihin natin ngayon na 99% yung composition ng ating mga na-detect out of all of these samples that we have sequenced, hindi lahat yan ay aktibo pa na kaso. Most of them are recovered already. So hindi po siya maiko-correlate na sabihin natin na bakit ganun ang dami, dapat madami pa tayong active cases. No, it's not that way that we interpret that. We interpret it na alam natin na most of those who have had COVID-19 in the country ay Delta ang naging variant at yun ang na-sequence sa kanila. But it doesn't mean that they are still active. Most of them have already recovered. Chola.
Thank you po, Yusek. The next question is from Neil Joe Morales of Reuters News. Sec Galvez said today in Laging Handa public briefing that mandated vaccination is necessary. Any comments po from DOH on this? How will that be enforced and ano pong legal basis, if ever?
Yes, sinagot na po natin ito. I think that was last Friday, nasabi natin, kailangan ng batas. Sinabi na po ng Department of Justice na we would want to pursue mandatory vaccination, a law should be there to support it. Pangalawa, sabi ko sa inyo nung Friday, we have reached that spectrum of regulation kung saan nung una nag-encourage lang tayo, nagna-nudge lang tayo para magpabakuna ang tao. Nakita natin na ang vaccine confidence mababa pa rin. We went to that level of incentivizing and disincentivizing people. Ibig sabihin, kapag ikaw ay fully vaccinated, you have privileges. Like you can go to the malls, you're fully vaccinated, papapasukin ka. No? So yung disincentivizing, yun pong hindi ka pwede pumasok kapag hindi ka bakunado, hindi ka pwedeng pumasok dun sa establishments na gusto mong puntahan. So nandun po tayo sa stage na yon. Sa tingin naman po natin, nagkakaroon po tayo ng headway dito sa ginagawa nating incentives and disincentives. But if we are really going to that direction of having this mandatory vaccination, again, let me reiterate, the DOH will support this if there is a law for us to be able to implement. And we are not going to pursue also and recommend na lahat dapat mandatory. May sectors lang na kailangan talaga makumpleto natin ang pagbabakuna. Example lang po ako, healthcare workers. Tayo po yung healthcare workers, dapat lahat tayo bakunado, humaharap po tayo sa pasyente. So yung risk natin, pag di tayo bakunado, maaari pa natin silang mahawa dun sa mga dito sa sakit na COVID-19. So it should be mandated that all healthcare workers should be vaccinated. Dahil importante po yan para sa trabaho natin at para maproteksyonan din natin ang ating sarili. Dahil araw-araw po exposed tayo dito sa sakit na ito, yung risk natin napakataas. So yun po yung example. But again, let me reiterate, a law should be there for us to be able to do this.
Thank you po, Yusek. Next question is from Red Mendoza of the Manila Times. Instead of face shields, will DOH order possible use of double masks or even goggles to prevent possible transmission of COVID into us?
Yes, Red, no? So, kaya nga sabi namin, antayin lang natin kasi meron na kaming initial discussions with our experts or tag experts at yan po talaga yung parang direction ng pag-uusap. Kasi alam naman po natin, primarily, kaya natin minandate na ang face shields ay gamitin natin for us to protect our eyes because there are evidence to state na ang COVID-19 can also be makapenetrate din yung eyes natin at pwede tayong ma-infection. Pero sinabi naman po simulat sa pulpa na kung wala tayong face shield, yung goggles naman po is okay din. Kaya lang, nagamit na lang yung face shield kasi binigyan pa tayo ng another advantage because it covers the entire of your face, yung inyong buong muka, and therefore, pag may nagsalita o kaya may umubo sa harap nyo, naproprotectionan din tayo kasi hindi tumatalsik yung kanilang mga virus sa face nyo. So pinag-uusapan lahat to, Red, the possibility of these goggles and the others na andyan po yan. Pag-usapan natin with experts and then we will provide appropriate recommendations to the IATF.
Thank you po, Yusek. For the last question from Greg and Caroline po, may we get DOH's view on DILG suggestion on making COVID-19 vaccination a requirement for 4-piece recipients to get their subsidy? Similar question po from Caroline. Ano po ang posisyon ng DOH na no vaccine, no ayuda policy sa 4-piece po? Ito po ba ang isa sa incentive na titingnan ng DOH para maengganyo ang mga tao na magpabakuna? O hindi pa po ito dapat gawin habang wala pa batas?
Well, Caroline and Greg, una-una, I think that is not part of our mandate anymore. No? So yung pagbibigay ng ayuda, the requirements for that, although of course, we work with the DSWD, katulad nung sa 4-piece, meron tayong mga health conditionalities dyan. So pag-uusapan po namin yan with DSWD, but I guess babalik at babalik po tayo lahat dun sa basihan. Yung basihan, yung legal basis for doing such things. Pero yun pong kailangan maintindihan natin how 4-piece work. Ang 4-piece po, nag-work yan by incentivizing families para magkaroon ng good health behavior, magkaroon ng good educational behavior, mapag-aral ng mga bata, mabigyan ng tamang health benefits, yung mga tao, ma-encourage sila na magkaroon ng good health-seeking behavior. So maaari po, no, bukas po tayo dyan na maaring baka pwedeng isama ang COVID-19 vaccination dito sa conditionalities ng 4Ps. Pero kailangan pag-aralang maigi kasi we do not want to violate also any rights of a specific individual in terms of receiving their benefits coming from government. So siguro mas maipapaliwanag po ng DSWD at saka ng DILG ito pong issue na ito regarding the 4Ps.
Salamat po, Yusek, for the clarification. That's all the questions we can accommodate for today. And for your final message po, Yusek, to our kababayan.
Yes, no? So maraming salamat po uli sa ating mga media partners. Alam po namin na kasama po namin kayong magpakalap, no, ng tamang impormasyon sa ating mga kababayan. Lagi po natin tatandaan, napaka-critical po ng phase natin ngayon dito po sa ating pandemic response. Alam natin, bumaba na ang ating mga kaso. Alam natin that most of our areas are at low risk already. And nakikita po natin na lumalabas na ang ating mga kababayan. Sabik na sabik ang ating mga kababayang lumabas. So sana po magtulong-tulong tayo na magpakalap tayo ng mga ating mga pagpapaalala sa ating mga kababayan. Uumpisahan ko ho ngayon ulit, nagpapaalala po ang Kagawaran ng Kalusugan sa lahat ng ating mga kababayan. Alam po natin at naiintindihan natin na gusto na nating lumabas lahat, katulad ng dati, pero lagi natin tatandaan na andito pa rin po yung virus, maari pa rin po tayo magkasakit, maari pa rin po tayong makapanghawa sa iba. So sana po patuloy po natin i-comply o sundin ang ating mga minimum public health standards. Lagi po tayo magsusuot ng face mask at face shield. Lagi po tayo mag-physical distancing, palagi ang mag-ugas ng kamay o i-sanitize ang kamay. Avoid the 3C settings. Ito po yung closed, crowded, at saka yung close contact settings. At pag nakita na ho natin na marami po ang tao doon sa lugar na pupuntahan natin, maaari pong ipagpaliban muna natin kung hindi naman po importante ang ating pakay doon sa pupuntahan natin. And most especially and importantly, magpabakuna na po tayo. Na andito na po ang mga bakuna, paniwalaan po natin ang kakayanan ng bakuna na protektahan tayong lahat. So yun lamang po, maraming salamat at sana po lahat po tayo ay mag-ingat. We will see all of you on Friday. Thank you, Jolo.
Thank you po, Yusek. Thank you, everyone. Stay safe po. See you on Friday.